Hi, I'm Dr. Ted, and this is Fracture Friday. For this episode, I have a very common fracture. It's a femoral neck fracture. It's also known as a hip fracture. Happens in the elderly population, usually happens as a result of a fall. The common thought process is not that you break your hip and then fall down, which some people still believe, I guess, or it could happen that way. There's no sense in arguing it. But most of the time what happens is that the patient falls down, and as a result of impacting the floor or whatever they happen to hit when they fall down, they break their hip. Okay. So the femoral neck is the top of the femur, basically part of the hip joint. So that is a problem because it has to do with the blood supply to the femoral head. So the femoral head is part of your hip joint. It's the femur part of your hip joint. So you know the hip joint is basically the acetabulum, which is the cup in the pelvis, and the head of the femur, which is the top of the femur. So if we were to just reduce the fracture and put screws in it, it will lead to what's called avascular necrosis. So avascular necrosis means that the blood supply to the bone has been disrupted, and then the bone dies and basically disappears, and it causes collapse and it won't work. So this AP of the pelvis here shows a displaced femoral neck fracture. So when it's displaced like this, then the blood supply is presumed to be disrupted, and therefore if we were to just put the bones back where they belong in alignment and put screws in there to hold it, it will fall apart eventually, and then this relatively elderly patient most of the time would have to go through yet another surgery to have those screws removed and to have hip replacement. So to avoid two surgeries, it's better to do the hip replacement right away. So this post-operative AP x-ray shows what's called a bipolar hemiarthroplasty, which means it's half of the hip has been replaced, which is the top half of the femur. We didn't replace the acetabular part. So in a hip replacement, we put a cup in the pelvis, and then we put a component in the femur, and that's called a total hip. This is half of a hip, thus the term hemiarthroplasty, or half of a hip replacement, which is what's currently done for displaced femoral neck fractures. Hope you enjoyed watching this video. Thanks for watching. Hi, Dr. Ted. Thanks for sticking around after the video. If you'd like to see some more content from us, please subscribe to the channel and like this video.